Divisions of trigeminal nerve: ophthalmic nerve, maxillary nerve, mandibular nerve. Ophthalmic nerve again 3 branches: lacrimal nerve, frontal nerve, nasociliary nerve. Now after ophthalmic nerve, now it is maxillary nerve. It is a pure sensory nerve. It passes through the cavernous sinus. It supplies the skin over maxilla, that is upper lip and lower eyelid. It also supplies upper teeth through the superior alveolar nerves, mandibular nerves. It is a mixed nerve. It is not a content of cavernous sinus. It passes through foramen ovale. It is the nerve of first pharyngeal arch. It supplies the muscles of mastication which are developing in first pharyngeal arch. It divides into 2 branches. Anterior division, motor branch, supplies the muscles of mastication. Posterior division, sensory branch. It mainly gives 3 branches. Posterior divisions of mandibular nerve divides into auriculotemporal nerve, lingual nerve, inferior alveolar nerve. Supplies the lower lip and skin over the mandible. Important information: mandibular nerve is not a content of cavernous sinus. Therefore, this nerve is spared in case of cavernous sinus thrombosis. Trigeminal nerve has 4 nuclei, 1 motor and 3 sensory. Motor nucleus in the pons. Main sensory nucleus. It is present in the pons. It receives touch and vibration sensations from same side of face. Mesencephalic sensory nucleus of trigeminal nerve. It extends into the midbrain. It receives proprioception of eyeball, mandible and tongue. Spinal sensory nucleus of trigeminal nerve. It extends into the medulla and spinal cord. It receives pain and temperature sensations from same side of face. Masseter reflex or jaw jerk. It is carried out by mandibular nerve. Mentum of mandible is hit using knee hammer. The mandible goes down. Change of positions of mandible. Proprioception is carried by mandibular branch of trigeminal nerve. Received by mesencephalic sensory nucleus of trigeminal nerve. Signals sent to the motor nucleus of trigeminal. Motor nucleus sends efferent fibers to the masseter muscle through the mandibular nerve. Masseter is activated, elevates the mandible. Mouth closes suddenly. Nucleus tractus solitarius. It is a sensory nucleus. It has 2 components. Tip. It receives the taste sensations. Bottom. It receives visual sensations like chemoreception, pressoreception. Taste sensation to the tip of nucleus tractus solitarius is carried out by FGV. It's the mnemonic. Facial nerve, glossopharyngeal nerve, vagus nerve. FGV. Facial nerve, glossopharyngeal nerve, vagus nerve. Facial nerve. Taste sensation from anterior 2/3 of the tongue is carried by chordae tympani nerve, branch of facial nerve. Glossopharyngeal nerve. It carries taste sensation from posterior 1/3 of the tongue. Vagus nerve. It carries taste sensation from posterior most part of the tongue and epiglottis. Blood pressure sensations. pH of the blood, amount of CO2 in blood. Signals received by the carotid sinus, then carried by the glossopharyngeal nerve. Signals received by the bottom of nucleus tractus saltorius in the medulla. Nucleus tractus saltorius sends information to other nuclei like dorsal nuclei of vagus. Parasympathetic nucleus, therefore cardio-inhibitory. Vagus nerve transmits inhibitory signals to SA node. Therefore, contractility or conductivity and chronicity of heart is decreased. Important information: carotid body and carotid sinus are present at bifurcation of common carotid artery into internal carotid artery. Vagus nerve works at SA node, that is atrial level.